Greetings, everyone. Welcome to another episode of The Professionals You Should Know. This show's about uncovering the journeys of professionals from different industries. And today, we have the eloquent and compassionate Abna Ajapong, who is a pharmacist. Thank you for coming on the show. It's really a pleasure to have you here.
Thanks for having me.
Anytime. So, what is it that you do?
Okay, so my name is Abna. I'm a pharmacist working primarily in the community sector. So most people do know, but there's three main sectors, I guess, in pharmacy. There's industry, which is sort of like manufacturing, drug discovery. So that's AstraZeneca, GSK, things like that.
Okay.
Then there's hospital, which is obviously working on the wards and stuff in a hospital. And then there's community. So community is mainly sort of the high street pharmacy. So Boots, Superdrug, Lloyd's, where you would go to pick up a prescription. So so as a community pharmacist, my main role is ensuring the safe, effective and legal running of the pharmacy. And that just basically means that I'm running the pharmacy in accordance with sort of GPHC standards. GPHC is our regulating body, stands for General Pharmaceutical Council. And that includes things like dispensing medications, making sure that all the prescriptions that we do dispense from are legally valid, rather clinically appropriate. We give sort of health promotion advice, give different services. Some are NHS services, some are private services. Examples would be like anti-malarials for people travelling to certain parts of the world. Vaccines like the flu vaccine, COVID vaccines, yellow fever, hair retention service.
Hair retention?
Hair retention.
Really?
Yeah, and it's a really popular service at the moment.
So this is the first time I've heard this.
So that's normally a private service that some companies offer. And it will just be the patient coming in, we assessing them, asking them questions about their health, whether they're on any medications, have got any history of like heart health problems, things like that. And if they're struggling, it's mainly males with like male pattern baldness, then there are different treatment options that they can get from the pharmacy. Some are topical in the form of creams, lotions, shampoos, and others are tablets which they take daily to help help them sort of regrow their hair.
I did not know that. Didn't know that at all.
It's a very popular service, and there's so many more services that we do.
Wow. So why pharmacy? How did you get into pharmacy? What was the journey?
Well, I knew I always wanted to work in healthcare.
Right. From what, the young age?
Yeah, young age, because I was always into science and I've always had a thing for like people and serving. Like I really am a people's person. Like I just love speaking to people and that kind of stuff. So it's changed through the years. At one point I wanted to be a teacher. I wanted to do midwifery, I wanted to be a nurse, I wanted to be a doctor. I actually ended up doing pharmacy through clearing, believe it or not. Okay. So I kind of went the traditional-ish route. I did my A-levels, which I did biology, chemistry, maths and French. And
French?
Yeah, I used to love languages as well. So from then I went to do my MPharm degree at the University of Hertfordshire, which is a 4-year master's degree. So the first 3 are sort of equivalent to what would be a BSc, so just a pharmacy degree, I guess. And then the final year is an incorporated master's. So after the 4 years at uni, you do what's called a pre-registration year, which is like a mandatory 52-week training program.
A year?
Yeah, for a whole year, exactly, And it's really intense. It's basically working full-time, so sort of learning on the job, but also still studying when you go home. So at the end of that training year, you have to sit the final registration exam, and until you pass that exam, you can't actually practice as a pharmacist. So if you don't pass the exam but you finished uni and you've got the MPharm degree, you'll be, I guess, a person with a pharmacy degree. And you can do other jobs with that. You can go into lab-based work, you can work in sort of pharmaceutical industries, but you can't actually practice as a pharmacist until you've got the registration or the license, which you get from passing the exam. So thankfully passed the exam and then became a registered pharmacist.
So why community and not into the hospital?
So I'm quite fortunate. In the 6 years I've been qualified, I've had the opportunity, a lot of opportunities have presented themselves to me to be able to do a bit of community and hospital and even a few placements within GP practices. And so I'm quite lucky in the sense that I feel like I've been exposed to quite a lot of the different sectors of pharmacy. And for me, community just always feels like the one that I gravitate to more so because you get to build a relationship with your patients and you get to, I guess, see them progress and hopefully improve. You see their conditions improving. you just sort of get to know them. I feel like you can help them more the more you know them. And I also like that community pharmacy is ever evolving. It's always changing. There are new services coming out all the time. I find it very fulfilling, basically.
Okay, so, I can see. So, is there like any particular story that reinforced that? Yeah, this is definitely the field that I want to be in.
There's quite a few.
Just one. This one.
I think, to be fair, the most recent one, which was probably only a few months ago, I had a patient who was wheelchair bound, and she came into the pharmacy wanting advice about some prescription medicines that she'd been taking for a while. So she came in and I spoke with her, and it was really busy, so she could see the queue building up behind her as we were speaking, and she had a lot of questions about just medicines, how to use her inhalers, things like that. So I just tried to be really patient with her and told her not to worry about the queue building up. They'll just have to wait so that I can give her my full attention and help her the best I could. She was really grateful, kept thanking me, and when she left, she later came back that same day towards the end of my shift and gave me flowers and chocolates.
Oh, that's so nice.
And she actually said that in all her years of being on those medicines, no one had ever actually sat her down to explain what exactly they are, what they're for, what time she should be taking them, what the interactions might be. And she said that I just made her feel very sort of, I guess, seen and heard. I didn't make her feel rushed and not panicked, even though there was a queue building up behind her. And for me, I felt like that day I had empowered that patient to, better take control of their own health and their medications, and just feel more confident in what they're taking, why they're taking it, what lifestyle changes they can make to sort of better manage their situation, and hopefully even maybe be able to come off some of the medications by just improving her overall health through lifestyle choices. That was very empowering, and I feel like days like that definitely reinforce that I'm in the right career, because they just make me feel like I have done what I like to do the most, which is obviously offer my, I guess, pharmacy services, and also just to genuinely help someone. It's things like that.
No, that's an amazing story, because I hear that most of the time where patients or individuals don't know why they're taking some of the medications.
It's really common.
But for you to sit down and again, once they understand why they're doing it, it makes them feel a lot more better. So
100%,
that's good. Do you feel that there's anyone that appreciates your service the most? So it could be like patients or colleagues or the government.
I think definitely it would be patients the most, especially during the pandemic, when it was really hard to get, I guess, appointments and things like that with the doctors. We were sort of the first port of call, and I think we are one of the most accessible healthcare professionals, because you can literally just walk into any pharmacy and just ask to speak to the pharmacist, and then from there you can be given health advice or be sold over-the-counter medications or be signposted to the relevant service. So I think definitely patients. I do think that over the last few years, again, mainly from the pandemic, that other healthcare professionals have started to appreciate us more, because I think it was Dr. Nortley Mesher, who you interviewed. I think she mentioned something like, we can't do our job unless others are doing theirs. And I feel like the healthcare industry is so integrated that without the people who are sort of delivering the medicines, cleaning the hospitals, providing food, none of us really would be able to do our job. So I think over the recent years, there's been like a greater appreciation, not just for pharmacists, but for other healthcare professionals from other healthcare professionals. So primarily I'd say patients, and then secondly I'd say probably other healthcare professionals.
I completely agree. And do you feel that there's any misconceptions to your role?
There definitely is. So the one that we hear all the time is all you do is stick labels on boxes all day, or you hear it at least once a week, and people are often like, so for example, the normal sort of chain of events is patient will see the doctor, doctor gives them a prescription, they take the prescription to the pharmacy gives them the medicine. When a patient comes to the pharmacy, they often think that the pharmacist just gets the medication off the shelf, the one that's written on the prescription, that we just stick a label on it and give it to them. But I think what they don't realise is that we have to do like legal checks to make sure that the prescription is legally valid. Then we have to do clinical checks to make sure that the prescribed medication is suitable for the person based on their age, their gender, whether they're pregnant, sometimes weight, other medication they're taking, allergies. There's so much that goes on behind the scenes, and that's what the sort of 10-minute waiting time is. So the biggest misconception is that we just hand out medications based off of what's on the prescription, but there's so much more that goes into making sure that that medication is safe, appropriate, and effective for that patient.
So if it wasn't safe and appropriate, would you be able to change that medication, or would you say, you probably speak to your GP about another medication?
Depending on what it is, and it happens quite a lot, I'd probably say, again, a couple of times a week we get a prescription which might be, for example, a child's antibiotic, but they've been prescribed an adult dose, or vice versa.
Okay.
It's quite common, because I mean, doctors are only human, and
right, yeah, of course,
as good as they are, sometimes they do make mistakes, especially with all the pressures that they're facing at the moment. So depending on what it is, but the majority of the time we would contact the original prescriber, which is normally the GP, or sometimes it might be mental health services or a nurse practitioner and things like that. We would call them up and just say, we received this prescription for patient XYZ, we just wanted to double check the dose, because the BNF states the dose should... BNF is basically the British National Formula. It's just what we reference. The BNF states the dose should be this, but you've prescribed this. Right. Sometimes there's a valid reason why the prescribers prescribe something outside of the normal dosing. Sometimes it might say, like... I don't know, I can't really think of an example, but sometimes there are genuine reasons. So if that's the case, then we'll go ahead and dispense the medication as prescribed, even though it's different to the dose that we normally see. And in those cases, we will just like make a note on the patient record saying has been prescribed a dose outside of the ordinary because of XYZ. We've spoken to Dr. XYZ. And then other times, the doctors are actually really grateful that we've spotted the mistake. And they're often very thankful. And then they'll just send out a new prescription, either electronically, or the patient might sometimes have to go and pick it up and then get the amended prescription with the correct medication.
Cool. You wouldn't be able to... Would you be able to... They always need a prescription.
They always need a prescription. Yeah, for the majority of the medications that we dispense on prescription, you need a prescription for. Right. But there's a small number which kind of overlap, so they can be classed as P medicines, and P just means pharmacy, which you don't need a prescription for.
Oh, okay.
So an example would be fluconazole, which is like an oral capsule to treat thrush. Sometimes doctors prescribe it, other times the doctors might just tell them to buy it over the counter. So if the doctor has, for whatever reason, prescribed, I don't know, an inappropriate quantity or an incorrect dose or something, once we've clarified it with the prescriber, if the patient doesn't want to wait for the new amended prescription, we can just sell it to them over the counter and just let them know what the correct dosing will be. So it depends on the medication, but a lot of times it would be a case of waiting for the new prescription, which often happens quite quickly, to be fair.
Okay. I didn't know all of this. It is a new word. Okay. All right. Wow. Okay. So what we're going to do, we're going to go to another part of the show. Okay. It's called Rapid Fire. It's not rapid, but it's 3 questions. Either pick a choice or a yes or no.
Okay.
All right. So for our first question, do you feel that the life expectancy would decrease without medications?
Yes.
Yeah. Okay. Fair enough.
I think because a lot of medications do help to either improve the quality of someone's life and also extend the length of their life. So patients who might be critically ill, or if a patient's got a really bad bacterial infection or something, without the treatment of the antibiotics, in theory that infection could potentially kill them. Same with like anaphylaxis, without the medication, again, that could kill them. And even things like diabetes, hypertension, if it's not managed well, it can unfortunately decrease the patient's life expectancy. So yeah, I definitely think medication, along with healthy lifestyle and healthy diet, exercise, can lengthen someone's lifespan.
Alright, good. For our second question, in your opinion, what topical solution will be most effective to treat a fungal infection? Antifungal creams or organic antifungal essential oils?
In my opinion, antifungal creams, only because they've got a lot more evidence base behind them. They've been researched a lot more, and whereas with some of the essential oils, they might vary in sort of their strength and their potency and the actual source that they came from. So there's not as much regulation with sort of like herbal, homeopathic and essential oil type of medication. So as a pharmacist, I'll definitely say the creams.
Okay. Alright, so for our last question, if you were suffering from back pain, what course of treatment would you seek? Anti-inflammatory or physiotherapy?
think it would depend on whether it's acute back pain or chronic back pain, and sort of a lot of other factors. But I think in the first instance, I probably would go to anti-inflammatories, especially if it is acute. And if it's more of a chronic thing, then I would look into physiotherapy. But yeah, to answer your question, I think I would go anti-inflammatory.
Okay, fair enough. All right. So for our final questions, so in your opinion, what would the healthcare industry be without pharmacy or your profession?
So I think without pharmacy and pharmacist, there'll be definitely a limit to the accessibility of medications, both prescription and over-the-counter, and just health advice. And I think also pharmacists play a very big role in health promotion. So rather than just treating the disease once it's happened, over the years there's been a shift to trying to prevent disease by taking every opportunity we can to speak to patients about lifestyle choices, even when they come in to just randomly buy something over the counter. Giving them advice, letting them know that we offer like weight management services and things like that. Stop smoking cessation services, so that if they were ever thinking about stopping smoking and they didn't know where to turn, they know that that service is available. So I think without pharmacists, there'll definitely be a lot more pressure on like emergency services, because a lot of times when people can't get into A&E or anything like that, they'll come to the pharmacy to see if there's anything we can either advise them or sell them. And if we didn't have that, I think the NHS would be even more stretched than it already is now. So
I didn't even think about that, you know. Instead of A&E, they go to pharmacy.
It's happened a lot more, especially since the pandemic. Like a lot of people come into the pharmacy for things that typically we wouldn't have seen probably 3 years ago. But yeah, we get everything now.
And are you able to help them when they come in?
A lot of times,
that would make more sense.
A lot of times it's something really minor, like they might just need a steroid cream, or they might need some pain relief, some slightly stronger pain relief than what you can buy off the normal shelf, so stronger than paracetamol and ibuprofen, so things containing codeine, or they might need an antifungal cream. There's quite a range of things that we can recommend, and even if we can't necessarily treat them, we can signpost them to the next best place, whether they need to see an optician rather than go into A&E. They might just be having minor irritation of the eye. We can sell antibiotic eye drops for bacterial eye infections. So I think if a lot more people were aware of the services that we provided to the community, they'd probably come there as their first point of call, rather than going into A&E or calling 999.
And that makes more sense.
Yeah, exactly, which will then alleviate some of the pressure on the rest of the emergency services and the NHS. So I think we're quite a crucial part.
I can see that, definitely. Yeah, okay. And do you feel that there's anything missing in your profession? It could be work-life balance, salary, could be supervision, could be loads of things. Is there anything that you...
I think, again, over the last few years, the profession has shifted a lot. It's become a lot more patient-focused rather than medication-focused. So traditionally, our main role really was dispensing medication. And now, like I said, it's a lot more health promotion, providing services. So now a lot of pharmacies actually have something called an ACT, which is an accuracy checking technician, who does the task of checking the, accuracy of the medication dispensed against the prescription. Obviously, that has to be done after the pharmacist has done the clinical assessment, but that then frees up so much time for us to be able to carry out the services and the health advice and things like that. So I think what's missing probably is, I'd say funding, because as you know, obviously the NHS, there's been a lot of cuts. So the services are increasing, the expectations are increasing, but we're not having as much funding. So unfortunately, it means that some pharmacies are having to reduce their opening hours, or they're having to get rid of staff. So essentially, you're working at the same level of busyness, but with less staff and less resources. So it is a bit tough. But then I think that goes for the whole of the NHS. So it's just one of those things where we've just had to adapt as best we can and just make sure that we're working in a safe way. I wouldn't say work-life balance. I actually think community pharmacy anyway gives me quite a good work-life balance.
Okay.
So I think the only thing missing would be nice if we had a bit more funding.
And do you see it progressing in any way? I know you're saying more health promotion, but do you see it progressing in any other way in a sense?
Yes, I think a lot of the things that traditionally only doctors could carry out. So again, up until about maybe 10 years ago, pharmacists weren't really enabled to do to give vaccination. So the flu vaccination, I think it's within the last 10 or so years.
Okay.
And then after that came all the other vaccinations and services and malaria prevention. So I think as time's going on, we're being given more, I guess, flexibility clinically to be able to do things that are within our competence. So I think in terms of progression, going forward, we will be able to alleviate some of the pressures off of the GPs and the doctors to do the things that only they can do, and then we'll be able to take on the tasks which I guess the two of us can do. So in terms of progression, I see it going towards a lot more of a clinical and patient focused, service focused role, as opposed to the traditional dispensing of medications role.
And do you feel that there will be like I don't know what technologies are out there, but do you see that in that profession the technology will be growing in a sense?
A lot. So again, in the last decade, there's a lot more like online pharmacies, robotic dispensing, and things like that. Yeah, there's quite a few of the big chains have like a dispensing robot. So you put in the prescription information onto the computer in store, and then the robot elsewhere assembles the medications. I know, it's crazy. Yeah. And all those kind of things, all those kind of things just free up time for us to do things, because obviously a robot can't do a vaccination. A robot can't do a smoking cessation consultation. A robot can't give emergency contraception. So doing the tasks, getting the robots to do the tasks that a robot can do, means that we can then do the tasks that only humans can do. So in that sense, I think it's definitely moving towards more service focused profession.
Oh, that's good. I thought that would be a little bit scary. I got, robots taking over, and,
Yeah, I mean...
No, but, okay. I didn't know about that. Yeah. Wow. And is there any way to find more information about you or your services?
So with regards to pharmacy in general, there are like loads of really good resources. So there's the PSNC for anyone thinking of becoming a pharmacist, that has loads of resources specifically about sort of community pharmacy. There's obviously the NHS website. About myself personally, you can find me on LinkedIn, just my name, Avna Ajafong, and I've actually recently joined Instagram, like I've got a pharmacy account, which is very new, so it's just Pharm Avna.
Okay, I'm going to put that down there because pleasure having you here.
Thank you for having
It's
me.
amazing, and I wish you well for the future.
Thank you so much. Likewise.
Thank you. And thank you for watching.